Before the break, I told you that we'll be talking about mental health. And if you are an OG of the show, you know this phase because he started the show. I think on our first episode of Living Well, he was here. I'm talking about Dr. Albert. But if you are new to the show, don't worry. Let's take his profile. And then when we come back, we meet him in person. Dr. Albert Sedohia is a specialist psychiatrist working currently at the psychiatry department of Korle Bu Teaching Hospital. He has worked with the psychiatry department of Korle Bu since 2013. Along the line, he has worked partly at the Accra Psychiatric Hospital and the Pantine Hospital. On private basis, Dr. Albert Sedohia currently works as the specialist psychiatrist for the Accra Medical Center and the VRE Hospital, Akosombo. As an additional duty, he serves as a clinical tutor at the University of Ghana Medical School. Dr. Albert Sedohia's passion is to impact and empower as many people as possible with accurate mental health information and help anyone with mental health illness, as well as contribute massively to the global aim of destigmatizing mental health illnesses. So there you have it. Dr. Albert is in the studio with us. Dr. Albert, thank you very much for joining us.
Welcome.
I think I'm tempted to go right into the conversation because I think we've done a lot of ice breaking behind the scenes and all that. But then let's take it slow. When we talk about mental health, I like to think about it as a buffet. There are a whole lot of conditions that can be considered as mental health. But today we are talking about adolescent people. So when we talk about adolescent people, what are some of, when we talk about adolescents, what are some of the common mental health issues that adolescents can face?
Thank you very much, and a good morning to your viewers. First of all, you said mental health is a buffet. What you're actually referring to is mental disorders.
Okay, mental disorders.
So I have to clarify that all the time, and almost every time I have an opportunity, I have to do that. So mental health is a state of well-being where an individual is able to handle normal day-to-day stresses, realize their own potentials, learn, work well, and contribute positively to the general society. So that's mental health. The mental disorders is a wide group of conditions that affect how you think, how you feel, and how you behave. So what you're actually referring to is mental disorders. Okay. People confuse the two all the time, so I always want to get that across right. Now, you're asking common mental illnesses among the adolescents. Adolescent is spanning from 10 to 19. It's a very slippery area. You know, it's a transition period from childhood to adulthood. The common conditions, of course, we see in all the clinics is anxiety disorders, depression. We have substance use disorders, which is on the increase these days. ADHD, that's attention deficit hyperactive disorder. We have bipolar disorders. We have PTSD, post-traumatic stress disorder. A lot of people are exposed to some stresses. We have OCD, obsessive compulsive disorders.
Is OCD a mental disorder? Because, you know, social media makes it look like OCD is flex.
You have the traits and then you have the disorder.
Okay.
The trait is if it doesn't cause too much distress to your functioning, then it's a trait. It can be okay, but if it becomes distressing to you, you can't do anything. For example, you keep checking your door, even though you've locked it, you go so many miles away, you come back to check it. Checking and rechecking. Packing and repacking. Washing your hands multiple times in a day. Germophobia, where you are afraid that your hands are dirty, there are germs, so you wash your hands severally. That becomes distressing to your functioning. Then it becomes a disorder. But if you're just generally a clean person, that is not OCD.
Okay.
So there's a difference.
Okay. So you've mentioned anxiety,
depression,
bipolar,
substance use disorders, ADHD, post-traumatic stress disorder, OCD. Yeah, and there's any of them that you can think about.
Okay, so
autism.
When we talk about adolescents, just as you mentioned, 10 to 19.
Yes.
These are Gen Zs.
Yes.
So this generation is heavy on social media.
Yeah.
So what role does social media then play in these disorders?
So social media increases the risk of these disorders I just mentioned. Anxiety, depression, and all the ADHD and all the ones I talk about, and even PTSD, because you can be traumatized on social media through cyberbullying. You can be traumatized. So it increases the risk. And social media also, people go through cyberbullying on social media. Yeah. It makes people have short attention span, because on social media you have very short content that are quite addicting, and things are done like quickly. So you might think in real life that's how it's supposed to be, but that's not how the reality is in real life. And you might have low self-esteem, body image issues, because people have to use filters on their face or their body. People can edit pictures and videos and post on social media, making it look like that is how things are with them in reality. And trust you me, we know there are a lot of people who smile to the screen in cameras and all that, but in their real life, they cry to sleep most of the days. So social media can give you that kind of pressure, where you think other people have got life figured out, where you think other people are living well and you are left behind. And why me, why me? So that can also give you that pressure. As social media, that's a negative aspect of social media, but it has some few positive aspects. It increases your social connectivity, it strengthens friendships and social connections, and it can also give you access to educational material, give you educational opportunities, access to help. Social media can also give you those few positive, but mostly with increasing overusing of social media, the negatives mostly outweigh the positives.
It's good you mentioned the positives, because hearing you talk, I'm just thinking, how then do we handle this? Because we can't do away with social media in our lifestyle. Sometimes, even with the internet, sometimes your test is on the internet. Your homework, you have to submit through the internet.
Yes.
But then the negatives seem to outweigh the positives.
If it is not handled well.
Okay.
So the things you need to do, you need to set time limits. Especially we are talking about the adolescent here. So, I always say this, that children are allowed to make mistakes if they are not guided. They are children. That's what makes them children. And they didn't come from trees. It came through human beings. Yeah. So you owe it as a responsibility as a parent, a guardian, a caregiver, to protect them, to guide them, to direct them, so that they toe the right path. So they are allowed to make mistakes if they are not guided. So as a caregiver, a guardian, or a parent, you need to set time limits. There should be some parental guidance. You should encourage more positive content from social media. The algorithm works with what you like. Yeah. If you follow more positive content, you'll be fed with more positive content. But on the same social media, there are negatives and there are positives. You can go to social media and have a whole course, like university course, and learn from experts for free on social media. You can also go there and have your morals corrupted, your life everything in danger, and every cyberbullied and all that. So you encourage them to subscribe more to positive content. And of course, there has to be some guidance as well. And to crown it all, you need to encourage more outdoor activities, real life social interactions, where we do away with the phones, the screens, and we talk among ourselves, like father, mother, daughter, whatever. And sports, hobbies, physical activities, taking walks. You have to encourage that as well, so that we can balance the two.
But the interesting thing is, when it comes to screen time, some mothers just want or some parents just want, okay, you have the tablet so that I can have my me time. But I understand what you mean by there has to be a balance, a little screen time, a little physical activities, and all that. Another thing that we've established in our previous conversations about mental health is the need for support.
Yes.
And when we talk about adolescents, they are like pillars that guide these adolescents. There's the parents, there's the people they spend most of their times with, who are the educators, the teachers. What role can these people play to provide support for adolescents?
Okay, so all the people you just mentioned, the parents, the community, and of course the school, these are the places that these adolescents spend a lot of time to promote their mental well-being. That is the mental health. The parents, for example, are supposed to provide a nurturing environment, a safe environment in their home, so that the children can grow well. The parents are supposed to model healthy lifestyles. They are to encourage healthy lifestyles in the children and model it themselves as well. They are supposed to encourage open communications. You're supposed to get close to your children. You should be their confidants. If there's anything they are facing in life, you should be the go-to person they come to. Most of the cases I see adolescents, the thing they are facing, their parents have no clue what they are going through. And they need somebody to speak to. If you are fortunate and they get to speak to someone who is knowledgeable and refers them appropriately, like some of the cases we manage, then they get help. Those who don't even know there are people to talk to, some will tell you, Doc, my source of stress is from the house. So I can't talk to anybody in the house. So the parents are supposed to make sure the home environment is safe and conducive. Open communication. Encourage healthy lifestyle and model it. So you don't tell your children not eat junk food and you are eating junk food. You don't tell them exercise and you don't exercise. You don't tell them don't use cursing words and you use curse. You understand? You have to model it. For the teachers, they're supposed to look out for certain decline in academic performance, change in behaviors, so that they appropriately refer them for help. So that's for the teachers. And they're supposed to also teach them, educate them on mental health and the need to promote it. Awareness by the teachers. The community, the same. We are supposed to make the community a safe place to be in and also give support and make accessibility to help available in the community. So, in a nutshell, all these groups of people or places where the adolescents get to spend most of their time have a lot of role, especially the family. Especially the family.
I'm listening to you and I'm wondering, when I hear creating a nurturing environment for the child, I'm just wondering, so where do we draw the line between being nurturing and disciplining the child?
So there is punishment and there is correction. Most of us were punished. Where you get a heavy knock on your head, you get spanked heavily out of frustration. That your mother or father is frustrated because of their own issues or because of what they are going through themselves in a marriage. So they just vent it all on you, the child, and you get to suffer it. But there is correction. Where when the child does something, you correct the child. The child should know what you just did is wrong. So because of that, I'm going to deny you of something. Or I'm going to give you a talk to. I'm going to talk to you. Let you know that their actions have consequences. We don't get to choose the consequences. We don't have the option to choose our actions. Consequences are inevitable based on the action you take. So you teach the child to know that if you involve yourself in an action, that action has an inherent consequence. So you teach them this. Yeah, there are issues where you might spank them a little, not too much to hurt them, to cause any trauma. You understand? So that is correction. Punishment is when you are angry, you are frustrated in your own life, having your own challenges, and you just vent on the child, throw the child up. No, that one is not allowed. Discipline is the child should have some limits. I always say that if you're a mother or father and you walk into the room and your child is doing something wrong and he or she continues, you failed. So children are allowed to make mistakes if you're not guided.
Because I just had to ask this question because there's this trending meme on social media that gentle parenting is not for the weak. Because you have to do it in such a way that you're not crossing lines. But then these toddlers can press your button and push you to the wall.
It's case by case. There's nobody has got life figured out. No. We are all experimenting. We are all day by day. Nobody knows how to do things the perfect way. There is no perfect family, no perfect system anywhere. So you look at your children. How best can I? You need to have some knowledge base. So how best can I help and shape them and do it as it fits your family?
Right. We veered off a little bit into parenting. Let's come back to mental health. We spoke about social media being one of the things that can lead to mental health. What are other risk factors that can lead an adolescent to have mental health issues or a mental disorder?
Good. I like the correction you just did. You got it right this time.
Yes,
you did well. So some of the risk factors, we use biopsychosocial. You know, biologically, there are genetic factors. You know, it runs in families. And I dare say that being on the field for a little over a decade, almost every family has somebody who is currently going through some form of mental illness or disorder or will go through it or is on the way out of it. Almost every family, if you take first to 10th generation. So when people hear mental disorders or mental illness, all they think about is what they think. That is, in quote, madness, which is not a diagnosis, it's a social construct. That is all people know about. That is what they think mental disorders are. No. It's a very wide spectrum. Autism, dementia, depression, bipolar, ADHD, all these are mental disorders. So the fact that what you see the person on the street is the one who is not being cared for, who is being left on their own, and that's not how it's supposed to be. So it's a wide spectrum. If you had a broken heart and after 2-3 weeks you are still sobbing, crying, and not going to work and all that, you are going through depression.
Yes.
That is a mental disorder. Nothing wrong with it. You just seek help, you get help, you are sorted, and you'll be back on your feet. Yeah. So there's nothing wrong about it. So genetic, if it runs in the family, you have somebody in the family, it increases your chances. If you have birth trauma, it increases your chance of possibly developing mental illnesses later on. If you have some neurodevelopmental issues, for example, if you have some birth asphyxia, or you have a diagnosed autism or other, it's also predisposed to other mental disorders as well. Then the psychological, there are people who naturally have poor coping skills. You realize when they have a challenge in life, like they fail a test, or they don't get some people when they get 98 over 100, they are not happy.
Yeah.
Like they want 100 over 100. Yeah. If they don't get 100, they're like, nah, they are disturbed. People who don't know how to cope with certain levels of stress, maybe they don't know how to handle peer pressure or stress or failure, those people are at an increased risk. People who have low self-esteem and poor negative perception about themselves, they never think they are enough. They always wish they were the best of the best in everything, but there's nothing like that ever. There's nothing like the most beautiful woman or the most handsome man. Nothing like that. It's based on who is the observer. You understand? So there are people who have low self-esteem and poor or negative perception of themselves. Those people are also at an increased risk. And then if you are socio-economically disadvantaged, I'm talking about from poor homes, homes where food on table, school fee payment problematic. And if you are also exposed to trauma, we call it advanced childhood experiences, where certain children go through physical trauma, emotional neglect, some have sexual abuse. And this is quite on the rise, but people don't talk about it. Yeah. Most of our clients that we get to see, most often we are the first people they talk to about their sexual trauma. And a lot of women go through it. About 1 out of every 4 female go through it. If you have a girl child, I always say it takes twice the effort to raise a girl child compared to a boy child. Because not only do you have to support, protect, and everything, you also have to protect her from almost every male figure in her life. Yeah. Almost every male figure. You also have to take care of the boy child as well, no doubt about that. But the female child has, so the exposure to this trauma can also predispose them to having PTSD, depression, anxiety, and all the other conditions. And substance abuse, poor life choices. Substance abuse, I can't overemphasize it because it's on the rise now. That 10 to 19 year period is a period of curiosity, where peer influence, whatever your parents you are saying, if you're not careful, they will not listen to you. You notice that your children will now listen more to their teachers than you. Yeah. Their peers than you. So whatever their peers do, who they associate with is very important. So if their peers are into smoking and drinking, they're likely to engage in such. And substance abuse increases their risk of mental disorders as well. And the trauma, I've already spoken about the trauma as well. So poor life choices. Physical inactivity, unhealthy eating, all these ones predispose the individual to developing mental illness.
And when you spoke about trauma, it just made me think a little bit that we live in a society where people seem to be okay with trauma. Things have happened to them and they don't even know that I'm supposed to speak to somebody about this. They just feel like, oh, it's a way there. Normal, we are colliding. But then whilst you grow up, you begin to act in a way that you don't even know that generates from this trauma that you've experienced whilst you were a child. But then let's not go deep into that. That's more like therapy session.
Yeah.
But you've mentioned a lot of disorders. As adults or guidance or educators, teachers, what are some of the signs we should be looking out for in these adolescents to be able to get help for them if they need some?
That's very, very crucial because let's take from the home, for example. So you know how your children behave. If there's a change in their routine, that should raise eyebrows. So your child is sleeping more now than before. They are sleeping less now than before. They are overreacting to minimal issues than before. They are looking sad than before. They have low energy. Everything is than before. There's a pre-morbid state than before. They are getting angry much more easily now than before. You see them crying, sobbing, or sometimes they're not able to give you eye contact. And they are no more open to you. Like when they come back from school, they run to mommy or daddy and they want to tell you everything that happened during the day. But now, they don't. You ask them, is there a problem? They say there's no problem. Anyone you see that there's a problem and you ask the person, is there a problem? And the person says there's no problem, it's a lie. So when there's a change, a shift from how you used to know the person to a different form, then you should begin to suspect. The person is now withdrawn to themselves. Activities that he or she engages in, if he likes to play football, he likes to play game, he likes to engage in certain hobbies, music, dance, whatever, and the person is no more doing singing, the person is no more doing it, you should suspect. The person almost always goes to the mosque to pray, or church on Sundays, or weekday church activities, or hang around with their friends, and they are no more doing any of these things. You should be observant enough to pick the cues and know that there could be a problem, and then begin to get closer, ask questions, show that you care, not that you're just trying to come and ask questions for the sake of asking. Show that you care, and if need be, get help for that in your child as early as possible. And of course, for school and also the home, if there's a gradual or sharp decline in academic performance, it's a clear sign. A gradual or sharp decline in academic, and also children who mostly become victims of bullying in school, or they are the perpetrators. They are not used to be perpetrators of bullying, but now they are the ones. They may be going through something at home, or they are learning something from somebody wrongly, or they are using some substance, or now they are almost always at the center of being victim of bullying. Then you should suspect. So these symptoms, and of course if they become aggressive and all these things, pointers, if there's a shift from the person's usual state, you should suspect it.
The talk about shift from the person's usual state is so important that until I decided to start taking my mental health serious, I didn't even know that sleeping too much is an issue.
It is.
And it's just the little things that we overlook.
Eating too less, eating too much, all that.
And eating things that you didn't used to eat.
Exactly. So they binge eat and junk food.
Yeah.
They eat less. They try to avoid things that you used to eat in the past. But now they say, no, somebody who's never been a vegetarian, all of a sudden, out of the blue says, I'm not a vegetarian. Eyebrows have to be raised. And then ask questions. And
then eating a lot more comfort food.
Yeah, emotional binge eating.
Yeah, because for someone, people love noodles. Let me use myself. I love noodles, but then when I see myself at the end of the day, I just want a big bowl of noodles and watch movies. And I'm like, there's a problem. I have to. You spoke about accessing help. How do we get help? Are there strategies that we can get help first for adolescents without them feeling a certain type of way, taking into consideration the society we live in and the stigma that comes along with seeking mental health?
That's where it starts from. The stigma when it comes to mental disorders. So people actually think mental health is a bad thing.
Yeah.
That's why I always want to define what mental health is and what mental disorders is. So mental health is a good thing.
Yeah.
WHO definition of health is complete state of physical, mental, and social well-being. So mental well-being is a good thing. Mental health is a good thing. Mental illness and disorders are things that you need help with. Now, to get help, it should start from the home. You know, extended family system is good. It's a good one. It's very, very protective. You have a lot of people in your space who care about you, who might notice a shift in your usual state, and who might come to your aid quicker. So when you see a shift, go to the person. Sometimes all the person needs is somebody to talk to, and their problem will subside, and another person's perspective will help them. That's all they need. But if there's nobody to talk to, then it becomes problematic. Then if it gets to a point where it becomes distressing to them functioning academically or socially or any means in a home or wherever, you get help for them. There are professionals all over. Psychiatrists, psychologists, counselors. Mentors play a big role in this as well. Mentors are people you're modeling after. It's expected that they know the road. So follow who know road. It's expected that they know road and they have being where you are now. So these are people you talk to. So there's help actually available. People should understand that there's nothing wrong with having a mental illness. Every single one of us, including you, including myself, including the one watching me, is at risk of mental illness. What may precipitate it, we don't know. When, we don't know. Because, for example, a woman may be okay and fine until she gets pregnant and going to deliver. Then she develops postpartum depression, postpartum psychosis, postpartum anxiety, or whatever postpartum issues. Through absolute no fault of hers, just because the hormonal surges and decline, and all, that's what's causing that. Somebody may be okay until he or she gets broken heart. And yes, males get broken hearts too. I've had to deal with 2 of them recently. It's real, both male and female, but we always think it's the females who get broken heart. Please, both ends. And the reaction is the same. They also cry. My agenda, we cry too when we get broken hearts. So there is help available. That's what people need to know. Every hospital has a mental health unit. It is when you don't talk about your issues, the doctors will not know that there's a problem. Sometimes, and some of the things that we need to look out for, which are left out. Physical symptoms without medical cause.
Let me come in here, because you and I have had that issue. How do I know that I'm talking to the right person? Because it took me a while to open up to you. So it's not about talking to people, but it's about knowing that I'm talking to the right person. So how do I know?
The right person, again, we cannot do without a family unit. The people who are in your best, who vouch for you the best are your family members. So the right person starts from the home. Your mother, your father. They are the people who are not likely to wash your dirty linen in public. Ideally. That is in an ideal home. But of course, I know there are homes that they are not the right people, because the home is where the stress is coming from.
Because this is Africa.
I know. But the right place, in an ideal home where it's supportive, nurturing, and encouraging, your parents, mom, dad, brother, sister, uncle, aunties, you talk to them. But the ones you can talk to and be 100% sure are professionals. They are trained to understand what you are going through, why you are going through them, and not only that, how to help you, the professionals. They are the ideal situation. Professionals, psychiatrists, psychologists, counselors, and sometimes mentors with experience. So to be sure you're talking to the right person, I will jump straight to professionals. You are best to talk to a professional than just anybody. These days, you can't trust anybody with your secret and your issues. Next, you have a beef with them. Details and screenshots will be flying on Facebook.
Live, like TikTok live.
Live. And you're going to describe and detail everything you guys have discussed in your most vulnerable moment. So, but you see, the professional owes it as a duty to you to keep confidentiality. Yeah. If they divulge, they'll lose their license.
And I think that was a turning point for me. Knowing that this person also has something to lose.
Yes.
So
safe.
Yeah.
Most of my clients, especially my private clients, and I'm big on private practice because a lot of people deserve confidentiality, privacy. Not everybody has to be in their space and know what's going on with them. No, it's a problem. There's a solution for every problem. And once it is sorted, everybody should be fine. Before my session, before my consultation, I always make it clear to you, this is a private consultation. Everything we talk about here is confidential. I am under no obligation to divulge if you don't give me permission. And just with this introduction, their shoulder drops.
Yeah, there's a lot. I have experienced it before. And there's like a whole 360 when you hear that, okay, this is a safe space.
It feels safe.
I think that introduction just... what I hear is, okay, this is a safe space.
Yes.
You can talk.
Yes.
Yeah.
People need to feel safe when they are divulging very sensitive information about themselves. For example, somebody will tell you, my father slept with me when I was 12 years. She's never told anybody. My brother slept with me, or my boss is sexually harassing me every day. I can't leave the job because that's my main source of income. She can't tell anybody. And she can't let the boss know she's telling somebody.
Yeah.
So she has to feel safe before she can divulge it to you.
I'm smiling because for someone who does a lot of gestures and my facial expression shows, I'm just thinking, how am I going to hear this and not do, really? but let's move on.
Yeah.
Has there been any evidence-based program that has helped to promote the issue of mental health in adolescents? Because when I spoke to you about us having a conversation on mental health, but this time, on adolescents, I just feel like we've spoken about mental health, mental disorders, but then as you've mentioned, 2019 is a very slippery stage.
Yes.
It can make and unmake you. The decisions you make at that time can just make and unmake you. And so, is there any evidence-based program that has helped to promote the awareness and the issue of mental health when it comes to adolescent people?
You know, mental health awareness is now growing, and thanks to our forebearers, our professors who trained us, and we're also carrying the torch, we're also advancing the cause. It's now growing, and it's a beautiful field. A lot of people are encouraged to come into the space so that we work together, help more people. There are social interventions. One of them is like youth awareness of mental health. This is to encourage the youth to know about how to promote their mental health, to be aware of mental illness and mental disorders. The awareness alone will open people's mind. Oh, okay, so what I'm going through could be this, could be anxiety, could be depression, could be this. The Eurocom were like, oh, okay. So it has a name, it has a label, and there is treatment available, you know. And then that's youth awareness for men. And then there is a SOS prevention program, which is Signs of Suicide Prevention Program. Again, targeted at the youth, where you let them know people can go through things where they get to the point where they just want to end it. If you talk to someone who has attempted suicide, they will confirm to you that they actually do not want to die. It is because at that point, there is an acute psychological distress they find themselves in, that they think there's no solution, there's no way out. So at that point, if they get somebody to talk to, they won't go ahead with it. So that's the most often, like my recent case, I'm trying to keep it anonymous as possible. It's a young girl in a school, let's say in Accra here, or let's say the person is in Kumasi, I don't know where it is. You don't have to know.
Yeah.
A young girl who can't speak to the parent because the parents just don't give her the opportunity. She's having ADHD. So she has poor attention. She has inattention. She's a little hyperactive and a little impulsive. And there's high expectations from the parent on this poor child, girl or boy. I don't have to tell you who the person is. The parents are top-notch professionals. Let's say one is a lawyer, one is an engineer. And they expect a lot from this poor child, that even if she does well in her own assessment, because she knows what she goes through, because she has inattention, it takes a lot to focus in class. It takes a lot for her to sit down and study. And she's still among, let's say, first 10 or first 5. Parents are saying, nah, when I was your age, I was first in class.
Yeah.
So it's too much perfectionism and too much high academic expectation from this poor child. So they don't talk to their parents. So these people, then the child goes to a point that I feel like ending my life. At that young age. This is in that 10 to 19-year group. And then I asked this poor child, do you have plans? She said, yes. What do you intend to do to take your life? She mentioned. These days we are not allowed to mention them on social media or, because we are not to encourage anybody to do. Yeah. But she mentioned detailed plan of going through with her, taking her life. What happened was, it's a very intelligent student, spoke to a school counselor. And the school counselor advised the child to be referred immediately to hospital. Then came to see a general practitioner, a medical officer in the facility, one of my private places. Smartly, this doctor knew that this borders on mental disorder, quickly referred to me to see. So that's how it's supposed to be. Yeah. If we are all aware of mental health and mental disorders and mental illness, we will know who to refer to who to see who. And this girl's life is being preserved. And we are going through the process. She's fine. She's doing what I've started medications, and we started the therapies and all that. So this is how it's supposed to be. Yeah, So there's youth awareness for mental health. There's suicide SOS prevention program, and then there is positive parenting program. Everything is about the home. Everything is about the home. If parents are taught to look out for early signs of mental disorders, it helps. If parents are taught to raise their children well, it will help. If parents are taught to provide an enabling environment for their children to become the best that they can be, and not to give undue pressure. Your child doesn't have to be the first in class all the time. Let me pass your Bible. In almost all years of education, it's not It's rarely will you see the best graduating student becoming the most affluent in life after school. So don't give them too much pressure. Some have to do well in school, and they have other aspect of their life to also develop. Music, dance, anything else they can combine. But if you always want your child to be number one, that's a bragging right for you, the parent. Too much pressure. I don't expect too much. That's what I want to. Yeah. A lot of parents put their children, and they show you their results. When I was African parents, they always did well when they were in school, but it's not true.
And they'll add the backup story of how we walk 8 kilometers to school, cross the river, climb the mountain, and then we still
you have a car or you have a school bus come to pick you. Times changes. Yeah. Your time. I also walk long distance to school, Zongo Junction to Dansuma, Wesley Grammar. But I will not let my children see. The best is you've gone through something. Mm-hmm. It's your responsibility to make sure that other people don't go through the same thing. But some parents, African parents, backward thinking parents, will make sure you also go through similar.
Same thing. Right. Very soon we'll be going for a break, but then let me kindly remind you that Living Well is brought to you by Tortina 74. And as I always say, let it never be said anywhere that I didn't do anything for you people, because I really love the audience. And so if you have severe pains, abdominal pains, high blood pressure, heart-related diseases, and chronic cough, then Tortina 74 is a super immune booster for good health. And we say that Tortina 74, a proven lifesaver for your general well-being. You can walk into any pharmacy and get the Tortina 74, but then if you want to purchase bulk, you can call Tortina on 024-607-3498 or 050-162-8931. You can also visit the website on www.dhi.com.gh. Very soon we'll be going on a break, and when we come back, Doc is still here. We'll talk more about how to handle mental health issues, especially among adolescents. So don't go anywhere, we'll be right back. All right, thank you very much for staying. If you just joined us, you've missed a little bit, but don't worry. We are live on Facebook, and so you can just go to our Facebook page on Metro TV Ghana, go back and watch. The beauty of Facebook, and you can also carry us along. Join the conversation, the comment section below, and let's just keep the conversation going. Share with friends. Before now, we've been talking about mental health. among adolescents. And Doc has made a lot of points, and among them is the fact that you have to talk to the right people, which you highly recommended a professional. But then, before you speak to the right people or you speak to a professional, as an individual going through some of these things, how do you cope? How do you manage whatever you are going through before you speak to a professional?
So you are able to cope best if you know how. That's the only way out. So you first of all have to know there's something like psychological distress, where you realize this is not me, this is not my sleep pattern, this is not my eating habit, this is not how I work, this is not how when I go to work, this is not how I behave. In your own self. Not everybody is able to figure this out, but if you're able to tell that there's a shift from how you used to do things, then you need to know that you need help. So now, how to cope? There are healthy ways to cope. One of them is, of course, healthy life choices. Healthy life choices. It's a very good one. Exercise, eating well, that's balanced diet. And, having a good social network. It's key. We are social beings. You can't survive alone. We cannot. No matter how severely or deeply introverted you are, you still need to have people who you can interact with as a human being. Yeah. So a good social support system. And, of course, there are things like... I've talked about exercise. You see, these are things that we take for granted. Exercise, healthy dieting, good social support system. Very important. Then we have...
Not to cut you, but personally, I feel like skincare does a lot to your mental health.
That's self-care.
Yeah.
It's good. So you love yourself. You are making sure you feel good. So that's self-care. Self-care is a way to cope, to make sure you feel good. And other things you need to do is mindfulness. When you're going through stress and you're going through anxiety and all that, your mind is like a monkey mind where you are all over the place. You are here, but you're not here. You're jumping from topic to topic, issue to issue, like you're carrying on the burden of the world. So mindfulness, your mind being here and now, enjoying the moment, appreciating what is happening now and here. Journaling, you can journal your thoughts. So you can go through them and see how your thought pattern have been. If it's a bit distorted, then you know there's a problem, you need help. And breathing exercise, relaxation, breathing exercises. If you notice before we started the program, I took in deep breath 2 or 3 times. That is because I know I'm going to speak to people. It's normal to have this feeling, a bit anxious or something. So relax yourself. There are people who have agoraphobia, fear of open spaces, fear of talking to crowds or a group of people. When was that? Recently, I was at a clinic, and one of the people who are going through training, I asked a question, and this person was shaking, sweating, and everybody could tell. I said, please come and sit down. And then I had to take her through so that she's relaxed. She knows the thing, but she can't answer because she's going through that phase. She's become paralyzed because of what she's going. So mindfulness, journaling, relaxation, breathing exercise. A lot of us take it for granted, but it's free, it's easy to do. Taking deep breath, hold it for about 3 seconds, and you breathe out longer than you breathe in. And to make it even more impactful, close your eyes, use your mind to follow the air. And if you also want to practice mindfulness, that is your mind here and now, use all the 5 senses. Ask yourself how many, let's say, name 10 things you see in this room. Then you realize your mind will come here and now, you name them. Name 3 things you feel on your skin. Then your mind will go to your skin and the things you feel on your skin. I will say, I feel my watch, and then my shoe. Name 3 things, or maybe name 2 things you can taste. Name 2 things you can smell. Name 5 things you can hear. Like in this room, I can tell I hear this. When you are doing that with all your senses, you are bringing your mind here and now. And whilst doing that, you can do that alongside the deep breathing exercise. It relaxes you. It helps you to cope better so that the situation doesn't escalate. So once you notice a shift yourself, you need to seek help. But these things you can do to help you. If you have healthy life choices, it helps you cope better. There are people who just get out and take long walks or long drives to clear their head. But over here, how many people do that? We don't even have parks.
Yeah.
We don't have parks where you can go, playgrounds, and just see. There's something very therapeutic about going to a playground, having kids shout.
People watching.
So I took my kids to water park somewhere, lakeside. Just the children in the water, shouting And splashing water is therapeutic. There's something therapeutic about it. But how many of us do it? Taking walks. And when you are taking a walk, again, practice mindfulness. This is what I advise all my clients. When you're walking along the road, the leaves on the tree, what's the coloration, the pattern of distribution, how many? The cars driving past you, what's the model of car, what's the registration number, who is driving, how many people are in the car? That brings your mind here and now. The exercise itself, people who are more physically active, the research shows that they are much more able to cope with stress than people who are not physically active. So the exercise itself releases some, apart from the benefit, it also releases some good feel chemicals. That makes you feel good, relax, and be able to cope better. You see, if you have the energy, the strength, you'll be able to handle things better. Right. So these are some of the ways: healthy life choices, mindfulness, journaling, and expressing your emotions through healthy means like arts, music, dancing, singing. Express your emotions, write it out, write a song, play music, dance, sing. These are ways you can cope. So there are people who, when they are not feeling too well, they just start singing. They just start dancing. They just start playing drums. These are healthy ways of coping.
Right.
If you have any issues.
Right. And I just want to put this out there that contrary to what people think, making sure that you are okay mentally is not a luxury. It's not a sika for abrabo or abro for abrabo. Trust me, I think I was just telling you this, that you don't know where you are until you take the initiative to take care of yourself.
Yes.
And be in a good mental health space. Because when you make that shift, there's a light bulb moment. You'll be like, was I living or was I just breathing? So this is not about luxury. This is not about a brofofo. Just try, just make conscious effort to be nice to yourself. Take care of yourself. Do things that will put yourself at peace and make you happy. We'll be going to the other segments soon, but let me ask, apart from stigmatization, which is obvious, and we are still
big, that's heavy.
Yeah, advocating for it not to be there, are there other barriers that have been a blockade when it comes to that mental health awareness?
Yeah, the mental health awareness creation, mental health service delivery, mental health, there are some barriers. Stigma is big.
Yeah.
It's, truthfully, throughout, till I graduated, became a qualified doctor, I had no much knowledge on mental health issues. None. So, yes, there are colleagues of mine who also were in my shoes, who also have very little knowledge on mental health issues. So, like I said earlier, one of the symptoms one of the things or the pointers we should be looking out for is when your child, the adolescent or the adult or whoever, has physical symptoms with no underlying medical cause. Physical symptoms, aches and pains, low energy, fatigue, but they've done all the tests, all the scans, all the hospital visit. They actually do what we call hospital shopping. And still, they don't see that should raise eyebrows as well. It's possibly having a mental, whatever. So, now the barriers, apart from stigma, and stigma is the main thing.
Yeah.
Lots of people may get to the point where they know there's a challenge, they need help, but they don't want to have anything to do with going to see a psychiatrist, going to see a psychologist. It means, in quotes, they are mad. It's not true. You have a challenge just like somebody with sickle cell, somebody with hypertension, diabetes, stroke, malaria, typhoid. Will willingly walk to the hospital. That's what we want to get to. There's nothing wrong, but the stigma. Yeah. And then not only at the individual level, how family. I've had a case recently where the individual is in his 30s, and they've known this patient, this client, to have been going this thing for over 15 years. But they're always saying, no, it's not, he'll be fine, he'll grow out of it. Oh, when you go to the hospital, when they give you medication, out of ignorance. And it will surprise you, some of the people who are advising wrongly are health workers. Family people, out of love, they think they are doing you good, but they're actually hurting you in the long run. So the main barrier is the stigma. People need to know there's nothing wrong seeking help from professionals like psychiatrists, psychologists, counselors, and mentors. There's nothing wrong with it. And there's nothing wrong being told that you have depression, you have bipolar disorder, you have autism, you have ADHD, you have PTSD, you have OCD. There's nothing wrong with it. There is treatment available. So just yesterday, a patient came to my consulting room, a relative of a patient, I even put it on my status, and dashed me perfume. Why? Because for a long time, the relative has been going through something for over 20 years. And, prayer counts, everything has been done, but still getting worsening over time. The person literally cannot function. Then somebody luckily recommended that the person come to see us. So he was referred, he came, and I was contacted. I said, no, don't worry. What your sibling has, there is treatment for it. Once we initiate treatment, and he adheres to treatment, he's compliant on it, I am assuring you he will improve and recover and just have to continue treatment. And 6 months down the line, no, is it 6 months? From September to January, October, November, December, just 3-4 months. Yeah. And he's back on his feet. Now we're actually doing occupational rehabilitation, where we want him to get back into the workforce. Mm-hmm. What if he didn't come to us? There was no way he was going to get help. Our superstition. We are too religious. Yeah. We love God more than God loves us. we want to fight for God. We are overly superstitious. Everything that we don't understand has to be caused by spirit. Yeah. Just yesterday, a colleague of mine, and I like the fact that more medical people are now aware of this. So they are referring the cases. So we are seeing them. This man is going through something. This patient is going through something. And it's all because of something. And there's treatment for it. I'm trying to keep it anonymous as possible. You see how difficult that is?
This patient is going through something and it's because of something.
Yes. But until the person met me, and if it was an online consultation, the patient was so sure this had to be spiritual. Why? Because he has gone to several hospitals. They've done all the labs and tests and scans, and everything came out normal. So this has to be spirit. It's my house people. Mm-hmm. I said, no. So we in the field, mental health professionals, understand why you are going through what you are going through. And we know how to help you. All you have to do is to walk through the doors or reach out. If you want private care, reach out. We may even have to come to you or see you in this afternoon. I'll go and see a client in a restaurant. Mm-hmm. We are eating and we are having consultation. Yeah. That is how I want mental health service delivery to be. Very demure, if I can use that word.
Very mindful.
It should be very mindful. It should be acceptable anywhere at all. So our psychiatric association leadership is promoting, backed fully by Mental Health Authority, is promoting decentralizing the service delivery. Not only should it be limited to Accra Psychiatric Hospital, Pantai, or Konebu, or Ankafu, or no. Every private hospital in Ghana should have psychiatrists consulting there who see patients there. Yeah. So right now, I consult to Accra Medical Center, Nyaho Medical Center, and of course, VRA as well. And most of my colleagues are also now, SNIT, we have psychiatrists there, lots of other places. Most of my colleagues are going to the field to see patients in all these hospitals. You don't have to come to Accra Psychiatric Hospital necessarily. If you want private home visit or office consultation or meeting in a posh 5-star restaurant, we'll meet you there. Yeah. Once you're able to afford. So the stigma is one, we are overly superstitious. And then it comes to the finances sometimes. Because it's not fully covered by insurance, finances becomes an issue. Socioeconomic disadvantage makes and ignorance. On the, people don't even know what they're going through is a mental illness, so they may not even come. And sometimes physical barriers. The person has certain conditions that make it a bit more difficult for maybe some disabilities or some issues. But the main issue is stigma. Yeah. Overly superstitious as a society. That blocks us. A lot of people get camped at prayer camps because as long as their relative is behaving unusually, we don't use normal and abnormal in psychiatry because normal and abnormal is relative. So unusual means you know the usual. This is not it. So once the person begins to behave unusually, it has to be spirit. Yeah. And that spirit has to be cast out, right? There's a popular prayer camp where they have services multiple times in a day. They will tell you, accommodation, everything is free, but you give offering, you give seed, you give everything. It's a business. Yeah. Most people prefer to go there. We have nothing against religious practices. Pray, go to your mosque, sacrifice, whatever you have to do it. But we are saying that there's a medical cause. God is not against medications. Pastors, prophets, who have hypertension, diabetes, sickle cell, asthma. Oh, we give them medication and they take it.
Yeah.
Just that they don't come and tell you. Because they are smart. They know that if they don't take the hypertensive or diabetic medication, they may end up having stroke. So they will take it in their closet and come and tell you, have faith, that there's nothing wrong with having faith. So this is what I always tell people. We all know God heals. We agree. By our faith. God heals. We agree. But do you know how God will heal you? You don't. So that's where the thing is.
Yeah.
That's the part of the teaching they don't tell us. God will heal you. God will get you out of the problem. But how he will do it, you don't know. Medications could be one of them.
Yeah.
So you need to embrace it. There's nothing wrong with it. So stigma, overly superstition, ignorance, these are some of the barriers. The physical barriers as well. And the finances. Because you have to pay for the service sometimes because it's not fully covered by insurance. Even that one, if you at least come to the hospital, you have to take car.
Yeah.
Some
Buy
people cannot afford it.
medications.
But medications are not free yet. We hope to get there, but they are not free yet. So those are some of the barriers that people, but the top three, Charlie, stigma.
Yeah.
Stigma.
Right. Very soon we'll get to do the aerobic segment, but before we go there, we've established that adolescence, slippery age. What are some of the implications of leaving some of these mental disorders unchecked?
A good question, because see, one, we prefer to catch them young, catch them early, diagnose them early, and then give them the appropriate therapies, appropriate treatment. It's not always medications, not always. If there's a need for medication, we will give. Mm-hmm. And most of the conditions, you don't have to necessarily be on medication for life, or on lots of medications for life. If there's a need for you to be on medication long term, maybe literally long term, there's nothing wrong with that. Hypertension, diabetes, it's not curable. Sickle cell is not curable. So you literally have to be on medication. Type 1 diabetes, it's through no fault of yours, but you have to be on insulin for the rest of your life. But people don't see anything wrong with that one.
Yeah.
It is when it comes to medication. And our medication, people always go for the side effects. No. We give you medications for the therapeutic effect, the side effect, the adverse effect, which is the unwanted effect. There are also ways we can treat it.
Yeah.
If you have side effects of any of our medications, there are antidotes to them. So that should not scare you. And every individual is different.
Right.
Very, very important. Now, if the conditions are not diagnosed early, recognized early, and brought to our attention early, it gets complicated. If the conditions are diagnosed and treatment, you not comply to treatment, you are risking what we call treatment resistance, which means the medication we are giving you may not fully work. We have to add on more and higher doses and much more advanced treatment options. So the aim is to get more people to know the early signs and symptoms of these mental disorders, so that they can bring them to our attention early to help them. You know, when the leaf is at the fresh stage, that is when you can bend it, right? Not when it is dried up. If you try bending it at that age, it will break. It's a proverb. Now, so when they are young and we see the condition, we're able to help. For example, substance use disorders. Once the person starts experimenting with the drugs, and then it's brought to our attention because the child is open to the parents about, my friends have introduced me to this substance, cannabis, or smoking cigarette, or this. We advise the person through motivational interviewing and all that, the person get the necessary help, and then the complication that comes with it will not happen. Depression, anxiety, PTSD, whatever. When the person gets help early, you may end up taking you off medications and you are still okay. I have clients who are off medications now and are just doing regular reviews, and they are very fine because the condition, it has a close-knit family system. Everybody cares about you. If there's a challenge, everybody comes rally around to make sure it's sorted. So you get help early. The condition is treated early. You are well stabilized, and you should be fine. So the complication is what happens. And the financial burden increases once the condition is not detected early. At the latter stage, you may have to go for admission for a week or 2 or 3. There are people who may be on admission for a month or 2 or 3, or even 6 months, because the condition is not complicated. And there are other things that come, the time that the family people have to spend. Your work. You may end up having to go off work because you are not functioning.
Yes.
So you may end up losing your job. Not that you'll be sacked because of your condition, no, but because you can't work and you'll be away for a year, you may have to be replaced. So those are some of the things that happen if the conditions go unchecked. So the idea is to hopefully catch them early.
Right. I think you've mentioned extensively how helpful exercising is. We are running out of time, so just wrap up in 2 minutes.
Okay, so what I always want to drive home is that, first of all, everybody is at risk of developing mental illness. We just don't know when and how. So treat people with mental illness or mental disorders with respect and dignity, because it could be you the next time, and you will wish to be treated well. And the other thing is the confusion in the media and everywhere about what mental health is and what mental illness or mental disorders are. So mental health is a good thing, all right? So mental health is a state of well-being where an individual is able to handle the normal daily stresses of life, realize their potentials, their abilities, work well, learn well, and contribute positively to the larger society. That is mental health. So mental health is synonymous with mental well-being. Then mental illness or mental disorders are a group of conditions or any condition that impacts negatively how you think, feel, and or behave.
Right.
Another thing I always want to tell people is some people think people have figured out life and they are at the receiving end and they are the only ones who are suffering. It's not true. Everybody is going through something. Everybody is fighting a silent battle. The one who is your mentor, who you think has got everything as easy, may be having certain personal problems. Right. So you are not going through what you are going through alone.
Right. Thank you very much, Dr. Albert.
Welcome.
For coming through. It's always a pleasure having this conversation with you. We will continue our conversation behind the scenes, but then I'm really grateful that you passed through. My name is Ethel Poplampo. The show is Living Well. Today we spoke about mental health in adolescents. Thank you for being a part of the show. I'll see you next week.